Thank you, Lachlan, and thank you to Suncorp for your ongoing support of the Resilient Australia Awards. This is the second year in which mental health and wellbeing has been a national award category, and the first time it has been part of the state awards program. It was really terrific being a member of this year's national judging panel. And even more terrific than that, it was really refreshing to see mental health and wellbeing the central point of many projects, not just in this category. There were 10 projects submitted this year, with 4 of those finalists for the national award today. The finalists for the National Mental Health and Wellbeing Awards are Phoenix Australia, Centre for Posttraumatic Mental Health in Victoria, for their project Helping the Helpers Support Other, Building Local Capabilities After the Victorian Black Summer Bushfires. Rant Arts in Tasmania for their project Launceston Connect. Southwest Hospital and Health Service in Queensland for their project Southwest Queensland Birdie Calls Collaborative Project. And McKillop Family Services Good Grief in New South Wales for their project Stormbirds. And you can read more about all of these projects on the AIDA website. The judging panel have awarded 2 highly commended and a winner for the Mental Health and Wellbeing Award. Our first highly commended award goes to Southwest Hospital and Health Service in Queensland for their project Southwest Queensland Birdie Calls Collaborative Project. I invite Kathy Morrow to join us on stage to collect the award. Birdie Calls Southwest Queensland is a highly successful collaborative partnership between Southwest Hospital and Health Services, tackling regional adversity through connected communities and healthy communities, school communities, regional councils, and Queensland Centre for Infant and Mental Health. A Train the Trainer program, the first in Queensland, evolved from the partnership, followed by an extensive tour of Southwest Queensland. Congratulations to the Southwest Hospital and Health Service. It's so important to establish a Train the Trainer program to help ensure that knowledge and experience are passed on so that everyone can benefit from shared knowledge. The second highly commended award goes to McKillop Family Services, Good Grief in New South Wales for their project Stormbirds. I'd like to invite the team to join us on stage to collect the award. McKillop knows that the changes and losses following a natural disaster can be traumatic, complex, and ongoing, particularly for vulnerable communities. As with other grief and trauma experiences, exposure to disaster has harmful effects on people's mental health and well-being, substantially affecting children and young people's outcomes in the short and longer term. Stormbirds builds the professional capacity to school communities to manage sustainable responses to the complex impacts of grief experienced by children following bushfires and floods. Congratulations to McKillop Family Services Good Grief. Strengthening the resilience and preparedness of diverse groups of children and young people to manage and overcome trauma is so important for our future. Okay, and lastly, to the winner of the 22 Resilient Australia National Mental Health and Wellbeing Award. Phoenix Australia, Centre for Posttraumatic Mental Health in Victoria for their project Helping the Helpers Support Other, Building a Local Capabilities After the Victorian Black Summer Bushfires. I invite Alexandra Howard to join us on stage to collect the award. While Alexandra makes, well, she's on the stage, we have a short video about helping the helpers support others, building local capabilities after the Victorian Black Summer bushfires.
The Phoenix Australia project was funded by the federal and state departments of health, and really the aim of the project was to help the helpers. So we knew that after the Black Summer bushfires there'd be long-lasting mental health impacts, and we just wanted to be able to equip people in their local communities to better support other people in their communities. Those people could be emergency services, GPs, health professionals, community leaders, school leaders. We targeted those people because they are trusted members of the community, and we were hearing that people were approaching these people anyway to get advice or have a shoulder to cry on. So we thought, well, let's strengthen the skills that those people have so they feel more confident to take on that really important role within a community recovery space. We set on training mental health professionals in best practice trauma treatment. We also provided community leaders with psychological first aid, and we provided some non-specialist health professionals with something called SOLAR, or what we consider a level 2 intervention. We were able to, across the couple of years, run 56 workshops in various places in the state and also virtually. You know, we've now got 1,800 people across the state who are skilled to respond in the event of another disaster, which I think is, you know, is a really great resource for the state. And I think the challenge for us now is thinking about how can we maintain those people's skills, or how can we call on those people again when inevitably the next disaster happens.
Congratulations, Phoenix Australia. A really great example on training and mentoring community leaders in mental health to take the learnings back to their communities. Congratulations once again to Southwest Hospital and Health Service, McKillop Family Services Good Grief, and Phoenix Australia.